One of the most common questions patients ask me after hysterectomy is, will sex feel the same or will it be better or worse? And the honest answer is, it depends. Today, I want to walk you through what the medical literature actually shows and why experiences differ so much and what matters most for sexual recovery. I'm Dr. Erica Montes, a gynecological surgeon, and I've performed hundreds of hysterectomies, and my goal is to help you feel informed, confident, and in control of the decisions you make about your body. Let's get into it. So first, big picture. For my patients, sexual function either stays the same or improves after hysterectomy. That improvement is often because surgery removes the original cause of pain with things such as fibroids, endometriosis, adenomyosis, or chronic heavy bleeding. And when pain and bleeding improve, desire, comfort, and satisfaction often improve too. But, and this is important, not everyone has that experience, and that doesn't mean anything went wrong. So let's talk about why sex can feel better after hysterectomy. Research shows improvement is more likely when hysterectomy treats a pain-generating condition. Common reasons sex improves are several. There's possibly no more pain from fibroids or endometriosis, no fear of bleeding during intercourse, less pelvic pressure, fullness, no worry about pregnancy, and likely improved quality of life and body confidence. For patients who had pain because of the uterus, removing it can actually be life-changing. So why can sex feel worse for some patients? This is a part that often isn't discussed. For some patients, sex becomes more uncomfortable for a few reasons that I want to discuss today. One of the most common causes is a condition called pelvic floor dysfunction or having tight muscles in the pelvis. And my patients know I discuss the pelvic floor all the time. Think about it like this. If some of your pain before hysterectomy was due to tight pelvic muscles, these muscles basically are forever tight, uncoordinated, and are used to guarding. And a hysterectomy will unfortunately not fix a tight pelvic floor. It may take away the inciting factor, but even after the original cause is removed, the muscles can stay tense due to years of this hypertense state. Also, the muscles can even worsen temporarily after surgery. Pelvic floor dysfunction can lead to pain with penetration, deep pelvic discomfort during intercourse, and a feeling of tightness or pressure after intercourse. Therefore, going to a pelvic floor physical therapist before and or after surgery is always my recommendation. Another reason sex can feel worse is due to hormone-related tissue changes. And most of the time, this can lead to symptoms of vaginal dryness or thinning of the tissues. And this will most likely happen or will be more noticeable if the ovaries are removed or if patients are already having pain with intercourse due to hormone changes before their hysterectomy because of perimenopause or menopause. Now remember, even if you keep your ovaries will lose function over time and sometimes even earlier than expected after surgery because they do lose half their blood supply from the hysterectomy. And it's these lower estrogen levels that can lead to symptoms like vaginal dryness, thinning of the vaginal tissue, burning or irritation with penetration, or pain that feels more surface level rather than deep. And I've said this before and I'll say it again. I always recommend to have a hormone plan in place before surgery so you're prepared and ready. Even another reason some patients can have pain after a hysterectomy can be due to the vaginal cuff or changes within the vagina. Some women can have scarring at the top of the vaginal canal, and this tissue can be less flexible or can be tender. Also, the vaginal length is shortened slightly due to the hysterectomy, and this can lead to pain or a change in how things feel afterwards. And finally, and the most important one, hysterectomy does not automatically cure endometriosis. Pain can persist if disease remains outside of the uterus, and patients can continue to have pain. Still, with this being said, studies consistently show 4 things. Most patients report stable or improved sexual function after hysterectomy. Outcomes depend more on pre-existing pain conditions and pelvic floor health than on the surgery alone. Removing the uterus doesn't automatically cause sexual dysfunction, and pelvic floor issues are a major predictor of persistent pain with intercourse after a hysterectomy. So when patients ask, will hysterectomy ruin my sex life? The data does not support that fear. Now let's discuss the cervix, because everyone wants to know about the cervix. Research comparing hysterectomy with a uterus and cervix removed versus what we call a supracervical hysterectomy, where the cervix is left in place, really shows no consistent difference in sexual satisfaction for most patients. What matters more is improvement in pelvic floor tension, localized hormone therapy to support the vaginal tissue, and emotional well-being and communication with your surgeon and partner. So when is it safe to resume sex? Most surgeons recommend waiting between 6 to 10 weeks until the vaginal cuff is fully healed, and resuming too early can increase the risk of pain, bleeding, or complications like a vaginal cuff dehiscence, and rushing can make pelvic floor tension worse. Always wait for clearance from your surgeon. So what actually improves sex after a hysterectomy? Again, pelvic floor physical therapy is one of the most underutilized tools. It can help relax overactive muscles, reduce spasms, and improve coordination and comfort. Another thing you can do is remember, just go slow. The first few times may feel different, and that's okay. Pain is not something that you need to push through. Improving vaginal dryness. Remember, hormone changes, especially if the ovaries are removed, can affect your lubrication and comfort. So it's always good to make sure your hormone plan is in place. And it's always important to address fear and anticipation. Pain history can condition the body to brace itself. So even when the cause is gone, the muscles may need retraining. Sex after hysterectomy is not a one-size-fits-all. For most patients, it's better, especially if surgery relieved years of pain. But if sex is painful after hysterectomy, you're not broken, you're not alone, and there are effective treatments. This conversation matters because patients deserve real expectations, not fear or false promises. If this topic resonates with you, talk to your surgeon and don't hesitate to ask about pelvic floor physical therapy and get that hormone plan in place before surgery. If this video helped you, share it or save it for someone who's preparing for a hysterectomy. And if you're comfortable, drop a comment or question below. Subscribe for more evidence-based gynecological information. And remember, ladies, never expect anyone to care more about your body than you do. I'll see you on the next one.